Hello, everyone. Thank you for taking the time to review my presentation. My name is LaShawn Fofong, and I will be presenting my findings from my MBA project in linear regression analysis. In this project, I analyzed the impact participation in an employee well-being program had on the nurse attrition rate. This analysis was conducted in April 2025 as part of the Data Driven Decision Making course. Before we dive into the data, let me briefly introduce myself. I am a highly motivated and result driven data professional with a background that combines strategic analysis that I developed through my MBA in IT management, as well as my practical experience in leveraging data to drive improvements across technology through my experience as a Scrum Master and software engineer, my experience in healthcare, where I worked over 25 years as a clinical nurse, and insurance domains, where I gained experience working in both technology and healthcare. I have a strong understanding of agile methodologies and project management, complemented by hands on experience with data analysis tools such as SQL and Power BI. I am passionate about transforming raw data into actionable insights that we can use to tell stories that empower informed decision making and optimize business outcomes. So, in this presentation, I will cover the following key areas. I will first introduce an overview of the study's background, including the business scenario, the business question, in which what I seek to answer, and the null hypothesis being tested. Then I'll explain why linear regression was chosen as the analysis technique. From there, I'll describe the data I used in the analysis, including the variables and their characteristics. Following that, I'll present the analysis output and the graphical displays. Then the implications of the data analysis, including my findings, limitations, and recommended actions. Finally, I'll close out with a summary of the key takeaways in my conclusion. This presentation addresses the critical issue of nurse retention amid increasing demand and persistent staffing shortages in 2025. A major healthcare system implemented an employee well-being program about 3 years ago to reduce job-related stress and improve nurse retention. This report analyzes the program's effectiveness by examining the relationship between monthly participation and nurse attrition rates using linear regression modeling, in which I use Microsoft Excel data analysis toolpack. The findings deliver crucial insight into the program's effect on nurse attrition, enabling informed decision. The business question that this analysis seeks to answer is, given the hospital's goal of mitigating nurse attrition through the employee well-being program, does a significant linear relationship exist between monthly program participation and nurse attrition rates over the past 3 years? And can this relationship inform future retention strategies? So our null hypothesis would simply state that there is no statistical significant linear relationship between the monthly program participation rate of nurses and the monthly nurse attrition rate. Given the hospital's objective to mitigate nurse attrition through the employee well-being program and the need to determine if a significant linear relationship existed between monthly program participation and the nurse attrition rates over the past 3 years, linear regression was selected as the appropriate analytical technique. Linear regression allows for the precise quantification of the relationship between both program participation rate and nurse attrition rates. It also generates a predictive linear equation and provides a framework for testing the null hypothesis. Regression analysis, we used an independent variable as well as a dependent variable, being that our independent variable would be the program participation rate, and this represents the percentage of nurses involved in the employee well-being program. For our dependent variable, the nurse attrition rate, which indicates the percentage of nurses who left their employment during each month. Both variables are ratio variables. The sample size was 36 observations, representing data collected across 36 months. So we did our analysis in Microsoft Excel using the data analysis toolkit. And from there, we were able to get a comprehensive report. On the bottom left, you see a detailed summary output of our analysis presenting the statistical measures and coefficients, followed by a scatter plot on the bottom left that visualizes the relationship between the independent and dependent variables. On the y-axis, we have the nurse attrition rate, and then on the x-axis is the program participation rate. Together, these elements offer a clear and complete view of the analysis results. As you can see, the trend line indicates a reduced turnover as participation rate increases. Turning to the results of our analysis, the model demonstrates a moderate to strong fit. Therefore, an R squared of 0.7485 or 75% indicates a moderate to strong fit of the variability in nurse attrition. But there is still a considerable amount of variation not accounted for by the model. Therefore, program participation accounts for 75% of variation in nurse attrition. This leaves 25% of the variation not measured in this analysis. This implies that while program participation rate is a relevant factor in explaining nurse attrition, other factors not included in this analysis also play a significant role. In linear regression, assessing the significance of the independent variable is crucial to determining if they have a statistical meaningful impact on the dependent variable. Statistical significance indicates whether the observed effect is likely a real effect or simply due to random chance. Statistical significance was assessed at the 0.5% level, indicating a 95% confidence level, whereas 5% indicates 95% of uncertainty. For this analysis, the independent variable is the program participation rate. The significance of this variable is evaluated using its p-value from the regression output. The p-value is a measure of how unsure we are about the program participation rate. The aim is to have a low p-value. A high p-value means we are more unsure. For example, the results could easily be due to chance, while a low p-value means we are less unsure and more confident in the effect the program participation rate has on nurse attrition. From the output, the p-value for the program participation rate is less than 1%. Therefore, we reject the null hypothesis and conclude that the program participation rate has a statistically significant effect on the nurse attrition rate. This suggests that changes in program participation strongly predict changes in nurse attrition, and this association is likely not due to random chance. The linear regression analysis generated the following calculations to the model the relationship between program participation and nurse attrition. Specifically, the model predicts that for every 1% increase in program participation, nurse attrition decreased by approximately 8%, as indicated by the slope of 0.81453147. The y-intercept of 5.2682 represents the estimated nurse attrition rate when program participation is zero. This relationship is expressed in the predictive equation or linear equation, y equals mx plus b, where y is the dependent variable, predicted nurse attrition rate, m is the coefficient, which is the slope of the trend line, x is the independent variable, program participation rate, and b is the y-intercept where the line crosses the y-axis. As the program participation rate increases, the predicted nurse attrition rate will decrease. Let's take a look at some strategic applications. The analysis has several. The model enables forecasting nutrition, evaluating program enhancement, setting data-driven targets, and monitoring program effectiveness. Some key limitations. It's important to note approximately 25% of attrition is influenced by other unmeasured factors, such as workload and compensation. Therefore, the findings should be interpreted cautiously. My recommendation is to leverage the program's positive impact while expanding future analysis to include these other attrition drivers for more comprehensive strategies. These strategies should include enhanced promotion, implementing a comprehensive communication plan to promote the program's benefits across diverse channels, barrier reduction, addressing logistical or scheduling barriers, incentive optimization, program enhancement. By increasing participation, the hospital can leverage the program to stabilize its nursing workforce and reduce turnover costs. To further refine retention strategies, the hospital should utilize the model's predictive capabilities to optimize resources and assess the return on investment for the program. Continuous monitoring of actual versus predicted attrition rates will allow for ongoing program refinement and the establishment of measurable retention targets. Regression analysis confirms a significant negative relationship. As nurse participation in the employee well-being program increases, nurse attrition rates decrease, demonstrating the program's effectiveness in reducing turnover. The finding strongly supports the hospital's continued investment in strategic enhancement of the program. For example, if a hospital increases its program participation rate from 60% to 70%, the model predicts a reduction in the attrition rate of approximately 8%. This could translate to retaining several additional nurses per year, leading to significant cost savings and improved patient care. Future analysis should incorporate additional variables such as workload, compensation, and job satisfaction to provide a more holistic understanding of nurse retention, thereby enabling the development of even more targeted and effective retention strategies. For instance, in future research reveals that high workload is a primary driver of attrition, the hospital could implement strategies to optimize staffing levels and reduce mandatory overtime, complementing the benefit of the employee well-being program. Thank you for your time and attention.